Routes of drug administration. Most drugs can be administered by a variety of routes. The choice of appropriate route in a given situation depends both on drug as well as patient-relate factors. These are generally categorized into 1. Local routes. 2. Systemic routes. 1. Local routes. This route involves delivering medications directly to a specific target site to achieve a high concentration at the desired area while minimizing systemic exposure and side effects elsewhere in the body. It includes a. Topical surface routes. Applying drug on the surface for localized action. For local effect, skin, mucous membrane, eye, nose, ear, lungs, anal canal, rectum, urethra, vagina, etc. For systemic effect, transdermal, where drugs often in patches, example, nicotine, fentanyl, are applied to intact skin to achieve controlled, continuous absorption into the local capillary system and systemic circulation. B. Deeper tissue routes using needle to deliver drugs to localized areas. C. Arterial supply, intraarterial, injecting a drug into a specific artery to localize its effect to a particular organ or limb. Merits of local route. The drug acts directly at the site of application, giving a more effective response where it's needed. Especially for areas like the lungs or nasal passages, drugs can act quickly without circulate through the whole body. Since less of the drug enters the bloodstream, there is a lower risk of unwanted effects in other parts of the body. Direct delivery often means smaller doses are sufficient compared to systemic routes. Drugs don't pass through the liver first, as they do when taken orally, so more of the active drug is available at the target site. Many local routes, like creams, eye drops, inhalers, are easy to use and don't involve injections. Ideal for treating infections, inflammation, or irritation in specific areas, examples, skin infections, eye inflammation. Demerits of local route. Only useful for diseases affecting a specific area, not suitable for systemic, whole-body, treatment. The drug may not penetrate deeply enough to reach all affected tissues. Drugs may be quickly removed, examples, by tears, mucus, or washing, requiring frequent application. Can cause irritation, allergy, or tissue damage at the site of application. The exact amount absorbed can vary depending on the site and condition of the tissue. Frequent applications, examples, eye drop, ointment, can be inconvenient. Some drugs cannot be effectively delivered via local routes due to poor permeability or instability. 2. Systemic route. These routes are primarily categorized into enteral and parenteral. A. Enteral route. This route can further be categorized as oral, sublingual buccal, and rectal. A. Oral route. Commonest and easiest method of drug administration. Both solid and liquid dosage forms can be given through this route. Merits of the oral route. It is the easiest and most convenient route, allowing patients to take medication at home without assistance. It does not break the skin barrier, reducing risks of infection and tissue damage, and provides a lower risk of acute allergic reactions. It is least expensive for both acute and chronic treatments. It is non-invasive and painless. It is highly preferred by patients over injections. It does not require healthcare professionals for administration. Oral medications like tablets, capsules, syrups are easy to store, transport, and produce in large quantities. Demerits of the oral route. Drugs with high first-pass effect needs to be given in high doses. Slow onset of action, typically 30 to 90 minutes, not suit for emergency. Irritation of gastric mucosa. Patient compliance is not ensured. Not complete absorption, low bioavailability. GIT diseases or abnormality, diarrhea, may affect the absorption of drug. B. Sublingual route. The tablet or pellet containing the drug is placed under the tongue, where it dissolves and is absorbed into the blood capillaries. Example, nitroglycerin. Merits of sublingual route. Rapid onset of action, because the highly number of vessels under the tongue, useful in emergency. Effect can be terminated by spitting out tablet. No maximal sterilization. No skill, self-medication. Avoid first-pass hepatic metabolism, no first-pass metabolism, equals increase bioavailability. Not affected by gastric acidity or intestinal enzymes. No food-drug interaction. Demerits of sublingual routes. Inconvenient for frequent use. Irritation of oral mucosa. Patient compliance not ensured. Not suitable for large doses. Vomiting patients. Bitter, vasoconstrictor, irritant or water-soluble drugs cannot be given. Limited drugs can be administered this way. C. Rectal route. Suppositories and retention enema can be used to administer drugs through the rectal route for systemic action. Example, indomethacin etc. Merits of rectal route. Dose requirement same or slightly greater than oral route for both the systemic effects and local effects. Drugs that are irritant to stomach. Suitable in unconscious, vomiting, motion sickness, migraine or when a patient cannot swallow, and when cooperation is lacking, sedation in children. Not needed sterilization. Can be safely self-administered or given by caregivers in a home. Partial bypass of first-pass metabolism, 50% to 66%. Because the rectum is supplied by branches of the systemic circulation in the lower half and those of the portal circulation in the upper half, any drug injected in the rectum will have 50% absorbed directly in the systemic and 50% absorbed in the local portal circulation. Suppositories may be used to produce local effect. Demerits of rectal route. The presence of fecal matter and low fluid volume cause unpredictable, slow, or incomplete absorption. Long-term use cause rectal mucosa irritation, inflammation. While it can bypass some liver metabolism, parts of the rectum drain into the portal circulation, leading to variable first-pass effects. Not suitable for all conditions like not ideal during diarrhea. B. Parental route. In this route, the drug does not pass through the gastrointestinal tract. It directly reaches to the blood. It can further be classified as 1. Without injections inhalation. 2. With injections. A. Intravascular. B. Intramuscular. C. Subcutaneous. 1. Without injections inhalation. This route involves delivering medications directly into the respiratory tract through the mouth or nose. Common delivery devices for this routes are metered dose inhalers, dry powder inhalers, nebulizers, and soft mist inhalers. Merits of inhalation. In general anesthesia rapidly taken up or eliminated. Self-administration is practicable. Aerosols and powders provide high local concentration for action on bronchi, minimizing systemic effects. Demerits of inhalation. Special apparatus is needed. Drug must be non-irritant if the patient is conscious. Obstructed bronchi, mucus plugs in asthma, may cause therapy to fail. 2. With injections. A. Intravascular. In this route, the drug is directly taken into the blood with the help of injection. Where absorption phase is bypassed. Merits of intravascular. Precise, accurate and rapid onset of action, useful in emergency. Large quantities can be given, fairly pain-free. Can be given to unconscious patients. Quick action. Drugs having unpleasant taste can be given. Demerits of intravascular. Costly. More chances of adverse effects, most dangerous. Pain irritation at the site of injection. Need skill and training, no self-medication. B. Intramuscular. In this route, the drug is given into the muscles. Blood flow is greater in muscles of upper arm and thigh. Drug once reaches to the muscles, absorbs into the blood. Generally, the more is the blood flow rate, the more is the rate of absorption. Merits of intramuscular. Reliable and suitable for irritant drugs and depot. Preparations can be used at monthly or longer intervals. Absorption is more rapid than following subcutaneous injection or oral route. Soluble preparations are absorbed within 10 to 30 minutes. Prolonged duration of action used for oily preparation. Demerits intramuscular. Inconvenient, may be painful especially for frequent use. More chances of adverse effects than oral, more rapid than the oral. Sterilization is mandatory to avoid infection. Technical skill required. Risks include nerve tissue injury. If any adverse effect occur to a depot formulation, it cannot be removed. C. Subcutaneous. In this route, the drug is given into the fatty tissue layer just beneath the dermis. It provides a slow, sustained release of medication, commonly used for insulin administration. Merits of subcutaneous. Can be used for local and systemic effects both. Reliable and acceptable for self-administration, low risk. Demerits of subcutaneous. Poor absorption in peripheral circulatory. Failure. Repeated injections at one site can cause lipodystrophy, resulting in erratic absorption.